United we're as strong.
Cori Gambini, and I'm president of CWA Local 1168 in Buffalo, New York.
And we're at the CWA convention, 2025 convention. What are some of the issues you think are important at this convention?
Some of the issues that are important is really going up against the Trump administration right now. They're dismantling unions. They just, the federal government, they just took away the VA's their contract. I have friends that live in Buffalo that work at the VA, and they just woke up one morning and they no longer had a contract. So the attacks on the National Labor Relations Board, all of that. So a lot of the convention's been around that we must stand up and fight back. The labor needs to be the leader in fighting back against this administration.
And Project 2025 is kind of a fascist program,
Absolutely.
Privatizing all public services, public education, having company unions. I think they're targeting the working class, the labor movement.
Absolutely, and they're widening the wealth gap between the very rich and the working class is going to start shifting into the working poor if we're not careful here.
And one of the issues is uniting all of labor because it's not one union, it's not one industry, the entire working class. You think there should be a movement for a national day of action of all labor in this country to unite all working people?
I do. There should be a national day of action, and I think also leaders, national union leaders, I think they all got to get on the same page, too. I think what we tend to do is focus solely on just our members. We stand up for a lot of things, but again, we get very focused on our members, and sometimes we'll put things aside because something may impact our members. And I think what's happening in this world is bigger than separate unions. It's much bigger than separate unions. So I'd like to see one big national union. That's
a national action, day of action, 1 million people in Washington,
yeah.
All workers uniting together. I mean, Sarah Nelson called for a general strike.
Yes.
Over the attack on the federal workers. It seems like no one is backing her up. She's like throws the call out there in silence. I mean, what does that mean? I mean, because it's
I don't know, and you know what? We have to find out.
And another issue that has come up is the genocide in Palestine. What's happening with our money? Billions of dollars are going from the United States.
I was for the amendment.
And what was the amendment?
The amendment was really to have stronger language in our international solidarity, to stand up for that, and it got voted down.
You think that there should have been more debate and discussion on this?
Yes, absolutely.
What would have happened if
I think if people would have taken the time and really were educated and really truly understood instead of the broad, what am I thinking of here, overview of it, right? And what may or may not happen. I believe my fellow CWAers would have voted to support it.
And I mean, if it was Ukraine, another country, there wouldn't be a problem. But since it's the Palestinians?
That I don't know. I'm not going to say, yeah, that's the problem. I won't say that's the problem.
It seems that, the United States, one budget item that did go up was military spending. While military spending is going up, they're cutting social services, they're cutting education. It seems, and a lot of people, even supporters of Trump, are angry that the United States is spending all this money overseas and people here are suffering.
Absolutely, I agree. I mean, we're going to dismantle our whole healthcare system. I'm president of a local that represents healthcare workers in CWA, and we right from the Medicaid cuts, we already started closing services. I'm getting calls while I'm here that they're announcing closures of services because of the impending Medicaid cuts. So
500,000 workers in healthcare may lose their jobs.
Right, but we're sending all that money to commit genocide. I mean, it's crazy. So,
and like 500,000 workers of many different unions, SEIU, CWA, AFSCME. It seems like even those unions that are being affected massively by Medicaid cutbacks are not uniting. There's no unity action by all the unions that are being affected by Medicaid.
I think and fascism does this. They create chaos, right? There is so much being thrown at us and so much going on that you really can't even keep up with stuff. So I agree. We will definitely, I work very closely with the SEIU Local 1199 in Buffalo, New York. We bargain contracts together for our healthcare workers. So I think that we'll be talking about putting, groups together that we've got to get aligned on this stuff. Labor does. There is labor groups, members that are a part of labor groups that are trying to unify.
All the unions getting out flyers to certain people who need healthcare that they're going to lose it. I mean, a lot of people don't realize
the problem's going to be is that all of our union contracts, people are going to be paying a lot more for health insurance because guess what? These hospitals will close. They have to get paid for the services that they are doing. So at the end of the day, somebody's going to pay for health care. And it's just not going to be the government, but we are going to be paying it through our contract with higher cost sharing for our very expensive.
Taken away from wages and every.
Absolutely, and we've been that's why I've been a big stance on universal health care because we have so many fights over health care coverage in our contracts. Where if we could have universal health care, that money can then go into wages and benefits for our members.
Well, the News Guild and my local passed a resolution for single payer for national health care, but it seems like it wasn't even brought up at the convention. I mean, it was the president, Claude Cummings, said we need cheaper health care. I don't really see that as the problem. Is the fact the money is going to the insurance companies, not to health care.
Oh yeah, they're making They're making billions in profits. And
United Healthcare using AI to
I see
deny
the stuff day to day taking care of patients and the care that they get and the staffing problems that we have because there's actually way too much money in healthcare. It's just not at the bedside.